Good afternoon, everyone. My name is Stéphane VOUILLAMOZ, and I'm co-founder and a solution engineer at Novelty. And I'm here today with you to show you what Novelty is doing in order to try to eradicate polio from Nigeria with information systems and data collected on mobile devices all the way up to the national level, and how we do this. But before I start, let me just quickly introduce you to Novelty. Novelty is a Swiss company which is based in Geneva. It was founded by three former WHO staff, Philippe Veltos, who is here in the room, Patrick Briand, who couldn't attend, and myself. And we each work close to 10 years for the World Health Organization. And we worked across different departments and around health and geographical information systems. And as a result, Novelty is active in the field of public health, and we also work on other humanitarian projects. We work with UN agencies, NGOs, the government, and local partners in the field. And our core activities, we do essentially everything which is around designing, analyzing, building, and deploying information systems, so health information systems, as well as geographical information systems. And we have a significant experience doing so in challenging locations where no internet connectivity is available, no electricity, and where our users just don't have a lot of experience interacting with computers or mobile devices or even software. This is supposed to be like an animated movie, which is actually captured from the website, which is publicly accessible, the end result. So I'm going to show you at the end just the URL so you can go and look for yourself how it works. But you're supposed here to see the tracks of 12,000 vaccination teams visiting every single Hamlet over there. And the result just shows red or green buffers around those places. So it tells you what is visited and what is not visited by the vaccination team. And this is how we manage to reach the all inhabited places. So the vaccination tracking system, it's an information system which can monitor house-to-house vaccination activities in the northern states of Nigeria. We have currently the 10 northern states of Nigeria, and we are going to have probably the whole country and probably even more. And it's important to understand that to eradicate polio from Nigeria, the current strategy is to increase the population immunity by going house to house, visiting every single house, and administering 2 drops of polio oral vaccine to every kid under 5. It's huge. It's a huge amount of work. And these vaccination campaigns occurs nearly every month, and they last for 4 to 5 days. Normally 4 days, but usually we send them on day 5 to do the cleanup where we identify the places that they missed. So how this is achieved? Well, the vaccination tracking system can compute geographic coverage. So in public health, we usually talk about immunization coverage or coverage. But in this system, what we talk about is geographic coverage. What are the places which are visited and to what extent they are visited? And so the vaccination tracking system for every settlement which is tracked during a campaign, which can be a really big number, we can compute for every single settlement and on a daily basis the geographic coverage. And once we compute this geographic coverage, well, according to the different settlement types, we can apply a given threshold to this geographic coverage, and then we can identify the cities, for instance, which are either missed or partially covered. And because this vaccination tracking system can monitor many campaigns, we've been monitoring 21 campaigns since January 2013. We are actually having a campaign right now. We can identify the chronically missed places. So if a place is tracked for 3 times with the system and it's missed 3 times, it's considered as a chronically missed settlement. And we want to send teams specifically to those areas because they may act as the remaining polio reservoirs. So I'm going to show you now how this is achieved technologically speaking. So how do we integrate all the different solution components together from the field all the way up to the national level where we can have an aggregated view of what's occurring during every single campaign. So the first solution component is a geodatabase. This is where we store every reference geographical data, such as the settlements, and we have around 500,000 settlements in this system. We also store the administrative boundaries because we want to be able to aggregate data and look at it from a state perspective or from an admin 1 and an admin 2 perspective. And it is architectured in a way that we have 20 GIS editors which are constantly editing the data, going and collect place names so that when we talk to people and tell them you have to go over there, the place name is the right one. And so we need to be able to do this constantly to constantly improve the data. So what we do is we essentially create two-ways replica, and GIS editors can take a replica offline on one of their laptops. They can work, and then once they are done, they can come back and push the data back to what we call the master geodatabase. And similarly, every now and then, we refresh the data on which the vaccination tracking system rely so that we get all the latest updates from the Nigeria master database. And in the Nigeria master database, we make sure that everything is harmonized, consolidated, and quality controlled. In this geodatabase, we essentially have 3 settlement types for which the geographic coverage is estimated. We have built-up areas, which are actually cities with more than 100 residences. We have small settlement areas, which are rural villages with 20 to 100 residences. And then we have hamlet areas, which actually regroup individual hamlets which are within 200 meters of one another. And each individual hamlet contains less than 20 residences. And we actually have 380,000 individual hamlets in the system, which are regrouped into 81,000 hamlet areas. And so in order to calculate the geographic coverage, what we do for built-up areas, for instance, is that we divide the polygon which represents the city into 50 by 50 square grids. And so if a built-up area has 100 grid cells and the vaccination teams visits 50 of them, the geographic coverage is 50%. And for hamlet areas, and small settlement areas, we use slightly different but similar technique to compute geographic coverage. And then we apply thresholds onto the different settlement types so that we can identify the places which are poorly covered. And so we can send the vaccination team on the next day because the vaccination campaigns last for 4 days. So how do we know where the vaccination team went? Well, we essentially equip them with a GPS-enabled phone. It's an Android phone on which we developed a custom piece of software, which is very dumb. All it does is it collects a GPS position every 2 minutes. We can actually configure this. And it relies on the GPS network only. So there is no data plan, and for 2 reasons mainly. The first one is that the phone coverage is not reliable everywhere in the northern states of Nigeria. And the second reason is that we have 16,000 vaccination teams, and if we were to give them a data plan to each of them, they would probably call the whole family, and the cost would be huge. So those phones operate completely offline. Yeah, it's written to 12,000 teams. This presentation was actually done 6 months ago, so the figures are not up to date. And there is no interaction required, so we don't have to train 16,000 people. All that we do is that we give them a phone at the beginning of the day, they put it into their pocket, and they do the vaccination like they usually do, and that's it. And so the other component is this local laptop. The local laptop is distributed to 60 people. Actually, we're going to scale up to 80 people. It's at the LGA level. In Nigeria, the LGA level is the second administrative level. And each of this person who has a laptop, so these 60 people are responsible to up to 200 vaccination teams. And they are responsible to get the phone at the end of the day. At the end of each day, they get the phone from the teams. And they plug them into the laptop using USB hub. It's really low-tech technology because they are local people, so we really need, there is a lot of rotation. When we train them, they go and they leave to go into the oil industry. So it really needs to be extremely simple. They just have to plug the phones. They see that they physically plug to the computer. They click a button. It imports the tracks from the phone into the laptop. And on those local laptops, which operate completely offline, we have a copy of the VTS database, so the geographical database, and we simply intersect the tracks with the different denominators which we looked at, and we can compute geographic coverage offline. We also load those laptops with offline satellite imagery. And the goal is that at the local level, they can take decision, they can have the analytics, they don't have to wait that the data goes into the cloud, that someone in Geneva produce some reports and give them the reports 2 or 3 days after. They have the result in 5 minutes. Sometimes it takes them more to just plug the laptops, but once the tracks are in to run the geospatial intersects, it's a few minutes. And then they can they can pull some report, they can just, in 2 clicks, they can get the missed or partially covered settlements, they can batch print maps and handle them to the ward focal points, which are at the 3rd administrative level, so that they can instruct their teams to go into the right place on the next day. And those guys who have the laptop, they have the same phone than the vaccination team, except that for those 60 guys, we give them a data plan. And so they can turn their phone into a MiFi device. And our solution constantly checks for internet connectivity. And when it has connectivity, it sends the tracks, the raw data. We don't manipulate the data. It sends the raw data all the way up to the national level, where we have an emergency operations center. So we get all the data from all the vaccination team, and it gets centralized in this place. This is what we call the EOC. It's a web-based dashboard, and everything is automated over there. So every time we receive tracks, GPS coordinates from vaccination teams, so there is a little process which imports the track in the database. It's exactly the same solution which is on the laptop, actually, except that here there is no manual intervention. We import everything, and we do the spatial intersect as well, and we have a consolidated view at the national level. It's fully automated. It updates the data in near real time, in the sense that it takes approximately 30 minutes, a little bit less. It actually depends on how many settlements are targeted by the campaign. Sometimes we have more settlements targeted, sometimes we have less. And here we actually can do cross-campaign analysis. This is where we can identify the chronically missed settlements. And the last solution component is this tablet application. It's the last that we put in, which is also known as the Hamlet Buster. And it sort of closes the loop, because when we identify the chronically missed settlements, we essentially load them onto this tablet. Because what we realize is that the settlements which are always chronically missed or chronically partially covered, it's because when vaccination teams reach a Hamlet area, they will most of the time visit the very first few hamlets, but they don't know the extent of that Hamlet area. And so when you look at the satellite imagery, you would see that the first one are visited, but all the rest is always missed. And it's not because they don't want to go there. They just don't see the extent of that Hamlet area. So what we do is we load those tablets, which also operate completely offline with offline imagery. We also load the feature classes, so all the settlements. And we highlight, you can see here in yellow, we highlight the chronically missed ones. And vaccination team can click on this, any settlements over there and ask the tablet to guide them over there. And they get a red arrow, which points to the settlements, and the compass, which is on the tablet, shows them where they are pointing to. And essentially, they just have to align the 2 arrows. And they also get the distance to that settlement. And with these tablets, again, we have no figures here, but with these tablets, we managed to reach a lot of zero-dose childs. So childs which never got any OPV drops. I'm just going to describe you the campaign workflow, because in terms of operation, it's pretty heavy. So Novelty is doing all the software solution components and all the user guides and the training. But we have a local partner in the field who is responsible for the operation and the logistic. Because imagine charging 6,000 phones every night. That's an operational challenge, which we can discuss later if you want. So the campaign workflow, it starts with the GPS-enabled phone, which collects timestamp data every 2 minutes. And those phones are picked up by the ward focal points, so the 3rd administrative level in Nigeria. They go to the 2nd administrative level, the LGHQ, every morning with motorbikes, and they collect the phones for their vaccination teams. Then they go back and they distribute. They go back to the ward, so the third administrative level, at the headquarters of the third administrative level, and they distribute the phones to the vaccination teams. The vaccination team go and do the vaccination work like they usually do, and they come back at the end of the day to return the phone to the ward focal points. The ward focal points go back to the LG HQ, where all the tracks are imported into the laptops. And over there, they can upload the tracks when they turn on their MiFi. They can produce the missed settlement reports as well as batch produce maps, which shows also the location of those places which are partially covered. And they have daily meetings so that the next day they can go to the right locations. And they can produce this missed settlement report. And just a key fact, some key facts and figures, just to show you that this is not a pilot. This has been going on since January 2013. We didn't update the figure again. Sorry. So we have 21 campaigns now. The September IPD is currently ongoing. We track 60 LGAs, and we are going to scale up to 80 LGAs on a per campaign basis. We have actually 6,000 teams now. Which visits up to 15,000 settlements. So we track up to 15,000 settlements. Actually, I didn't look at the latest numbers, but it's probably bigger than this now. It generates, it's actually 5 million tracks per day. In a single year, we receive up to 5 million tracks, which are processed in less than 30 minutes. And for a given campaign, last time we looked, it was 17 million GPS positions just for one campaign. And it probably now contains 150 million tracks in the system. The zero-dose child, we've now reached like thousands of zero-dose child with the Hamlet booster. This was really at the beginning of this last component, this figure. Just so you know, the settlements as well as the boundaries for the Nigeria data are shared on OSM. We also try to put them on open data portal from Esri, and I think it's available over there as well. And the vaccination tracking system is actually a public website, which I'm not sure. I don't have any keyboard here, but I would like to pull the website, but I guess I can't. So I'm going to just give you the URL. Actually, if you go on our website, which is you got a threefold into the little the bag that you got at the beginning of the conference, there is a tree folder of our company. And if you go on our website, there is a link to the vaccination tracking system where you can see all the tracks from vaccination teams. You can play the tracks on a per day and team basis so you can see what they visit or not. And the tracks are also used to do a lot of other projects like validating roads and things like those. So the URL, if you want to write it down, it's vts.eocng.org. Otherwise, you can go to our website again. Thank you very much.